Evening, everyone in Australia, and good morning for those in the UK. So my study, Jeff, I think mine gets close to yours, although I don't have as many medical comorbidities with mine. But I tried Accel Heal fairly recently on one of my patients. Sorry. 67-year-old female, history of psoriasis, hypertension, varicose veins, venous insufficiency with stasis dermatitis. She wasn't a diabetic, but she did have chronic back pain, which impacted on her mobility. She had a history of varicose veins, which have now been treated, increased BMI, a history of multiple births. She had a set of twins. She was a smoker, although when I first saw her, she'd stopped. She worked in a factory, basically on her feet all day, and she was on Divan and Midol and normal diet and fluids. Wound history, first identified in 2013. I saw her for the first time in about mid-2015, 2016. She'd had repeated hospitalizations for cellulitis, multiple oral and intravenous antibiotics. She had a wound biopsy in 2015 and it was confirmed as a venous leg ulcer, and a scan in 2018 to confirm again, an MRI in 2018, which was normal, arterial duplex, which is normal. I also had done a Doppler and vascular assessment. Lots and lots of people were involved in this lady. We've had multiple wound and vascular clinics, 3 different hospitals. I've taken her to pain specialists, dermatologists, GPs, infectious disease specialists, dietitians, and I've even got her into quit because she's unfortunately started smoking again. Lots, as with previous discussions, pain was a really, really big issue with this lady and still has been. Lots and lots of opioid medication use, recurrent infections, everything that you could possibly get on this wound we've had. High exudate, a massive odour, to the point where her work colleagues complained about the smell and she had to stop work for a while. Recurrent biofilm issues and edema originally, although we managed that fairly well with compression. Lots and lots of, you can see I've tried everything and clinics have tried every different dressing. We've always had her in compression therapy, but you can see there's a big range of dressing products there that we've tried on her. Despite all of this, we just couldn't get her healed. She's had a variety of compression treatments, but at the moment she's in a compression wrap for her right leg, the main leg, the left leg, she's in double layer short stretch bandage. So we tried the Accel Heal. First of all, it's a circumferential wound. So we tried it first on the left medial aspect of the leg, and this is the medial aspect. And so we focused on this one because it was the most painful. And when we first measured it, it measured 75 by 45 millimeters. And you can see there's a lot of peri-wound issues there. And this is day 1 when we put the dressing, the Accel Heal electrodes on. The issue that we had is I couldn't apply the electrodes horizontally because it was a circumferential wound. So we did have some initial issues with the distal electrode with the exudate, which was moderate, but we did actually end up putting an additional pad over the lower electrode, and that seemed to manage it. And then we dressed her with normal dressing. So you can see the way we separated the wires from the skin was actually putting extra pads and then bringing it up through the stocking in it, that you can't see because it's wrapped under, but there was no pressure issues. Day 3 of treatment, we didn't actually get a lot of pain relief in the first few days, but she did say for the first, initially she required less analgesia, but then as it progressed, it crept up again. But she did actually take less analgesia than before. We had a cleaning up of the wound, marked improvement in the slough and biofilm content, but she did actually kick back into pain again. That was day 3. This is still the medial wound, day 9. We still had, as you can see on the distal part of the wound, biofilm issues, so we actually tried to clean that up, but the wound itself, she said, felt better. It was starting to reduce in size and we were getting a reduction in biofilm. And then day 8 of post-treatment, after we'd stopped, she'd had a 12-day cycle. This is 8 days after treatment. And you can see that the wound is actually starting to reduce in size. It was a very difficult wound to measure because it was circumferential. There was less exudate, the pain levels unchanged at that time, but the wound generally looked better. And this is day 16 post-treatment. And again, you can see that we're starting to get a reduction in the size and the exudate volume. The odor was gone, and she was starting to feel that there was less pain. This is day 67, which is recently, the 15th of October. And you can see again, a significant difference. We did have a bit of a glitch where she had an infection, and we got her on some oral antibiotics. But once that all settled, we've had remarkable progress for this wound, which has been around since, if you say 2013, I've been seeing it since 2015. Reduced odor, reduced exudate, generally reduction in wound size. This is day 75, which is the most recent photo I have, 23rd of the 10th. She'd finished her antibiotics. The exudate was minimal. And for the first time ever that I've known this lady, she said, "I don't believe it, I have no pain." She was just amazed. So we were so excited about it that we actually tried it on the left lateral part of her circumferential wound. This was day 1 of treatment. You can see we have biofilm. It's quite a deep wound. Again, it was probably the second most painful wound that she had. The largest length, which I measured from the malleolus up, was about 76 millimeters. And this is day 12 of treatment, so her last day of her Accel Heal. And you can see that we're actually getting a much, much cleaner wound bed, and we're starting to get epithelial growth. And she felt that she was taking much less analgesia. And this is day 42 on October the 23rd. And you can see again, marked improvement in the wound, much cleaner, less biofilm, and less pain. And then we were so thoroughly excited, we decided to try the posterior wound, which has been present for about 4 years. And this was the initial day 1 treatment. And then the only other photo I've got is day 9 treatment. I saw her today. It's probably half that size, the posterior wound. And she's so thoroughly excited about it all. We had no real issues with the application of the electrodes, except, as I said, the exudate issues. And these are some of the comments she made to me throughout the procedure. She was just amazed how quickly the wound started to improve. And she finally had hope. These wounds have been around for 6 years. They've impacted on her emotionally, financially. She's been unable to work, so she's lost heaps of money. Her work colleagues were complaining about odor. And she's just so excited. And one of the comments I thought was relevant to her, she said she just hopes this device is something that other patients like herself can use to help these recalcitrant wounds, because she's gone through hell in the last 6 years. My comments are, I could see she was really anxious, but she just needed some hope. And almost immediately I could see some progress with reduced fluff and less purulent exudate. Pain relief, although that was a bit sluggish at the end, as I said, the last time I spoke to her, she didn't have any pain. And I think it's just an important device that we can use as part of our toolbox. It doesn't replace best practice wound management. It doesn't replace compression therapy of the venous leg ulcers, but it is just something else that you can try to improve these really chronic, complex wounds. Thank you.